Hello, everyone. My name is Tavares Brown, and I will be doing my position stand summary presentation on wound care with a focus on the management of acute skin trauma. So we're going to jump right into it. How will you use this position statement to guide your practice? My response to this question was to overall strengthen your abilities as an athletic trainer. I feel like it is going to be beneficial in some form of emergency care courses. Also, I feel like it's a high likelihood that many athletes will encounter this issue, more than none, considering that, you have those high contact sports, or you just have those injuries where it's not so much of a muscle, tendon, bone issue, but more of just a skin issue, and also have the ability to be ready and know what is necessary in that given situation. It's always good to know ahead of time than not to at all. So some key points I wanted to point out from my article that I had was that acute wound care all begins by understanding the levels of integrity of the epidermis, the dermis, subcutaneous tissues, or a combination of more than one. And being able to understand the severity of the tissue will be beneficial for an athletic trainer to better understand the proper steps that are needed to begin the healing process. Being able to understand that this cut has reached this area of the tissue will help you be able to understand, okay, I need this will not be able to undergo a normal dressing of, just a patch or a route. So being able to understand the the level of which the skin has been interrupted, then you will be able to better understand how to treat and help the athlete in order to get them back to participation as soon as possible. Another point was that many patients do not seek medical attention after the injury. I felt like that was a very important point in the article because as an athletic trainer, you have to be able to not only communicate with them, but also to observe that when an athlete needs medical attention. Um, Being able to catch these things early will help the athlete be able to come back to participation sooner than later. It helps the athlete be able to not hurt himself worse, cause an infection, or make the wound, a bigger issue than what it actually is. So I thought that was a very important point that I wanted to point out in my presentation. The use of saline and potable tap water are the two most common forms of cleansing a wound after the initial skin trauma. I think those were two important ones because they are very accessible to you, and they're very time effective to the healing process, because using these two forms of cleansing will help you get to the next step of dressing and being able to help that situation from escalating and helping the athlete. Another point was in some cases that chemical debridement should be avoided due to the fact that some components could cause tissue damage. So it's kind of a situation where you might think that you are helping, but in reality, you could be doing more harm to the athlete and causing it to still have that form of damage. But not only you think you're actually getting it out, but in all reality, you are just probably spreading it out around the initial wound area. And that is not what you want to do. The objective is to be able to help and not make it worse. Being able to dress the wound is one of the most important factors in promoting the healing process. Taking time to properly dress the wound can be the key to shortening the healing process. So, being able to use the right bandage, making sure that the wound stays moisturized, and so the skin can grow back and help and closing everything, that is one of the most important parts of managing an acute skin trauma. Some additional information I wanted to point out was the emphasis on the cleaning and dressing wounds to return to play. The question I would have is, due to the lack of set procedures, what has been the most consistent between, the conversations between ATs, because a lot of people say that it's not, from what I read, that it isn't a 100% confirmed way through research that they have up to date on what are the proper steps. What are proper steps? I guess it all stems from the point of that all acute skin traumas are not the same in some aspects. So I guess just finding that balance in between what's right, what are procedures, what's right and what's wrong, you could say. Some specific information I wanted to point out was that the use of high pressure irrigation between 4 and 15 psi is the best practice for cleansing superficial wounds. Cleansing solutions should have a temperature between 98.68 degrees Fahrenheit and 107.68 to promote healing. From what I read, it says that if the solution tends to be too low, it won't promote the healing process because it won't kill the bacteria in order to begin the healing process. And another point is, for a wound to return to a normal temperature, it could take up to 40 minutes. So after initial cleaning and everything, the wound could be in a state of trauma or shock to the body, which causes your temperature to rise. So it takes roughly around a little less than an hour for your wound to return to its normal body temperature. And one last point I wanted to make is that scrubbing and swabbing method shows a lack of evidence to show its effectiveness in wound care. So from what I've noticed, I think most people tend to do on the side of using the pressurized solutions to effectively clean a wound, because at the end of the day, the most important component of our job is to be able to help these athletes and do it in a timely manner so they can return to play. And last but not least, this is my reference from where I received all my information. And I just want to thank you all for taking your time out and listening. And I hope this helps you. Thank you.